Smoking is the number one cause of death by lung cancer among both men and women. And that's because cigarette smoke contains numerous carcinogenic chemicals, including arsenic, benzene, cadmium, polonium-210, vinyl chloride, and formaldehyde. If you currently smoke, quit now. And if you know you'll have a hard time, see your doctor for medical help. The evidence is clear. If you're smoking, you're literally asking to get cancer. And the survival rate for lung cancer is very low. I'll tell you more about this in my report, How to Prevent Cancer. But now let's move on to the second problem, which is almost entirely overlooked by the medical establishment. As a result, the public is in the dark about it. Avoid iodine deficiency. We have an epidemic of iodine deficiency in this country, and my research indicates that it's a major contributor to the increased rates of thyroid, breast, prostate, ovarian, and uterine cancers. Here's why. Iodine is essential to every cell in the body, but is especially important to your thyroid gland, which makes the hormone that regulates metabolism. You can't throw your body's metabolism off and expect to be healthy. And that's what iodine deficiency does. Iodine is also essential for healthy glandular tissue, which includes the prostate, as well as for healthy breast tissue. Very early in the 20th century, we saw an epidemic of goiter in this country, which is caused by iodine deficiency. In simple terms, goiter is a swollen thyroid. It can cause difficulty swallowing and result in reduced thyroid hormone, slower metabolism, weight gain, insomnia, fatigue, brain fog, depression, and, if left unchecked, could lead to cancer. Now, are you ready for a shocker? In my practice, I always test new patients for iodine. I have found that over 96% of my patients are iodine deficient, and most are severely deficient. I suspect it's the same for the population at large. Let's see why getting enough iodine is important to cancer prevention. In a 5-year study conducted almost 90 years ago, an Ohio physician, Dr. David Marine, was able to prove that the epidemic of goiter was caused by an iodine deficiency. After he demonstrated that goiter and its resultant underactive thyroid gland could be cured with iodine, supplementary iodine was added to salt, and for many years to bread. Go to your local supermarket and you'll see the dark blue canister of iodized salt. In fact, it's probably in your cupboard. But my research on this subject has shown that the amount of iodine in iodized salt is not nearly enough. And since the 1970s, the public has been told to cut down on salt, making this problem worse. Also in the 1970s, the baking industry replaced the iodine in breads, crackers, cookies, pasta, and pastries with a cheaper substitute called bromine. Replacing iodine with bromine was one of the dumbest things ever done by the food industry because it has created a new epidemic of iodine deficiency, leading to an underactive thyroid gland, obesity, fatigue, and probably cancer. Here's why. Bromine binds to iodine receptors in your body and blocks the absorption of iodine from the foods you eat. Our agricultural soils are already low in iodine, so the crops they produce are iodine deficient. And now bromine is blocking what little iodine you get. Consider that bromine is used in foods and medicines as a disinfectant for swimming pools and spas and in hundreds of consumer products, including the interior parts of automobiles. Making matters worse, the FDA has set the recommended daily allowance for iodine at least 100 times too low. And considering that bromine is ubiquitous in foods and consumer products, most people aren't getting nearly enough iodine. The resulting iodine deficiency is wreaking havoc with our thyroid and prostate glands and is leading to diseased breast tissue. This is why I believe we have a 30-fold increase in fibrocystic breast disease, lumpy tissue, which is often a precursor to breast cancer. Sadly, conventionally trained doctors are completely unaware of this iodine deficiency, even as more and more people develop thyroid, breast, and prostate cancer. Let me tell you about one of my patients who came to me after a diagnosis of severe fibrocystic breast disease. Her breast specialist recommended mastectomy. I prescribed a high daily dose of iodine, and in 6 weeks her fibrocystic breast disease her foods. This one seems obvious. Nobody would ask for synthetic chemicals or unnatural foods, and yet hundreds of millions of people are consuming them without knowing it. That's because chemical additives and genetically modified food ingredients are used in thousands of supermarket foods, typically hidden on labels under safe-sounding names. For instance, conventionally raised animals are fed diets that contain synthetic hormones, antibiotics, and genetically modified organisms called GMOs that have been shown in studies to cause cancer. They're in dairy products, beef, chicken, pork, and farm-raised fish. On the other hand, organically grown animals are free of these chemicals. Many people mistakenly think that eating red meat can cause heart disease and cancer, but the problem isn't the meat, but rather the chemicals in it, or the GMO feed given to the animals. If you buy organically grown beef, chicken, or pork free of hormones, antibiotics, and GMOs, they are healthy sources of protein, as long as they're part of a balanced diet that also includes fresh fruits and vegetables. Here's another problem with the standard American diet. The vast majority of conventionally grown fruits and vegetables sold in grocery stores are sprayed with pesticides, herbicides, and chemical fertilizers. And many of these chemicals are known carcinogens. Here again, the solution is simple. Eat certified organic fruits and vegetables that are free of pesticides, herbicides, and chemical fertilizers. Next, avoid artificial sweeteners, which are in hundreds of supermarket foods because they have known disease-causing chemicals in them. One popular brand of artificial sweeteners contains chlorine, which is in the same family as bromine and will inhibit iodine absorption. As you've just learned, you need iodine not only for good health, but for cell apoptosis. When you eat products made with these chemicals, not only are you risking turning normal cells into precancerous cells, but your immune system will struggle to kill the precancerous cells. Do this long enough, and you can hear those dreaded words: you have cancer. Two of the biggest name artificial sweeteners, currently in hundreds of supermarket foods, have been shown to create cancer in laboratory animals. Common chemical sweeteners also cause inflammation and have been implicated in brain diseases. These are widely used in diet sodas, sugar-free ice creams, and hundreds of foods that claim to have reduced calories or no sugar added. Ironically, these chemically sweetened diet foods do very little to help people lose weight, but they can cause normal cells to turn precancerous, and with continued use, they can cause precancerous cells to turn into cancer. What's a simple solution? Instead of using artificial sweeteners, see my cancer prevention kit for several natural sweeteners that are both low in calories and safe for everybody, including diabetics. All of this is easier to do than you think, and here's why. Just ahead, you'll see a special subscription offer. Cancer cells have an abnormal metabolism that requires sugar for fuel. What's more, sugar has been shown to suppress the immune system for up to 5 hours. If you snack on candy or soft drinks every few hours, and then you finish your dinner with a sweet dessert, you are suppressing your immune system almost continuously, and that's an open-door invitation to a poor immune system, which could lead to cancer. When people are diagnosed with cancer, they are always shocked, but they never consider that it may have been all the sugar they were consuming. Likewise, their oncologists never say, stop eating sugar and carbs immediately. Instead, they say, be sure to keep your weight up while you undergo surgery, chemotherapy, and radiation. Many cancer patients take this advice to mean that they need to eat sugary, high-calorie, and high-carbohydrate foods, and that's exactly what the cancer cells require to grow. But don't wait for a cancer diagnosis. Eliminate refined sugars from your diet now. And if you already have a cancer diagnosis, immediately eliminate sugar from your diet, including all refined carbohydrate foods, which are converted to sugar once inside your body. The natural sugars in fresh fruits are okay, but not the sugar added to bottled fruit juices, canned fruit, and fruit-flavored yogurts. Many people believe that fruit-flavored yogurts are healthy foods, but nothing could be further from the truth. These yogurts are loaded with sugar. They often contain more sugar than ice cream. If you like yogurt, buy plain organic yogurt and add your own fresh fruit. And if you need to sweeten it, add a small amount of organic stevia, xylitol, or organic raw honey. Next, avoid refined grains, oils, and salts, all of which are unhealthy and put you at a greater risk for cancer, as well as arthritis, diabetes, and heart disease. Refined grains and carbohydrate foods include cereals, white bread, white pasta, white rice, white potatoes, cookies, cakes, chips, and almost all processed foods in boxes, bags, cans, cartons, and bottles. Carbohydrate foods are converted to sugar once inside your body, and processed foods contain refined grains and sugars. I can't stress this too strongly. Cancer thrives on sugar. Sugar-coated cereals are particularly bad. Even unsweetened cereals made with refined grains are unhealthy. What's more, both refined sugars and refined oils are inflammatory, and health researchers now know that inflammation is at the heart of all the degenerative diseases, including arthritis, diabetes, obesity, heart disease, and cancer. When you receive your copy of the Guide to Healthy Eating, free with your risk-free subscription to Natural Way to Health, you'll find healthy food choices that eliminate refined sugars and also move you toward a healthy body pH that's not too acidic. This is important because cancer not only loves sugar, it also loves an acidic body pH. And you guessed it, the standard American diet is highly acidic. Let me give you a few good food choices right now. You can eat oatmeal, nuts, and products made with organic whole grain flours that have not been brominated, but watch out for sugars and chemical additives. You can eat yams, but for the most part avoid all products made with white flour, as well as white potatoes, rice, and pasta. You can eat all the fresh fruits and vegetables you want, but choose organic produce, as these will not have the residues of carcinogenic pesticides and chemical fertilizers in them. Next, it's important to avoid refined and processed oils. Bad fats and oils include margarine, canola, corn, cottonseed, peanut, safflower, and soybean oils, and any other product whose label includes the words partially hydrogenated oil. All of these oils have been shown to suppress the immune system over time by producing toxic trans fatty acids. They also increase body inflammation, and if they're genetically modified, which 75% of corn and 95% of soy are, they have the potential to cause cancer, which was demonstrated in a lifetime study with animals fed a 10% to 33% GMO diet. Healthy oils include organic butter, coconut oil, and cold-pressed extra virgin olive oil. These 3 healthy fats should serve all of your needs, but you'll find a couple more safe choices in your free copy of the Guide to Healthy Eating. White table salt, which has been processed and bleached and is devoid of nutrients. This includes the blue canister of iodized salt. Instead, use organic unrefined sea salt, which is natural and contains nutritious minerals. Remember, you can't get enough iodine in iodized salt, so choose organic sea salt and supplement iodine drops separately. All of this might sound complicated, but it's not. You're simply replacing bad foods with good foods, and you'll make the choices you want. You'll find that naturally healthy foods are more delicious, will give you more energy, won't cause digestive problems, and will naturally reduce your weight. Best of all, they won't lead to degenerative diseases. And speaking of bad foods to avoid, I'd also like you to have another of my reports, 5 common foods that damage your health. In it, you'll discover the very real dangers of soy, chemical sweeteners, refined carbohydrate foods, and 2 other common foods that are probably in your refrigerator right now. Soy has been promoted as healthy, but that's flat out wrong. There is only one form of soy that won't do harm, and that's fermented soy. Every non-fermented soybean food, including edamame beans, soy milk, and all soy ingredients in processed foods, is unhealthy and harmful to your body. Why have we been misled on soy? Because soybeans are among the most profitable crops in the U.S., and most are genetically modified. Thousands of packaged foods in supermarkets contain GMO soy ingredients that are harmful and can potentially cause cancer. You can thank Washington's food manufacturing lobbyists for enshrining this misinformation in the government's food guide, and for allowing these harmful foods in our food supply in the first place. Genetically modified foods were approved over 20 years ago after just 3 months of testing on lab animals with an average 33-month lifespan. No problems showed up in the 90 days of testing. But since then, full-life animal studies have shown aggressive breast cancers, liver and kidney diseases, and premature death as early as 4 months, and in much bigger numbers at 18 to 21 months. That's ages 10 to 50 in human years. Americans have been eating GMO foods for more than 20 years, and in high quantities in the last 11 years. That's why many health experts believe we're headed for a cancer crisis very soon. But cancer doesn't have to strike your family if you take the preventive steps I'm giving you today. One of the most important reasons to read my Natural Way to Health newsletter each month is that I'll tell you when the government, the food industry, and the drug industry are misleading you. Again, watch for the big orange button at the bottom of your screen to remove toxic metals from your body. In addition to testing my patients for iodine, hormone levels, and vitamin and mineral deficiencies, I also test for toxic metals, including mercury, lead, cadmium, arsenic, and nickel. All of these heavy metals will suppress your immune system, and a compromised immune system will struggle to kill precancerous cells in your body that can turn into cancer. I've tested thousands of patients for these heavy metals, and I've found that fully 70% of them have dangerously toxic levels. The biggest problem is mercury, which is pure poison. Most of these patients don't have a clue where they picked up these harmful metals. But you can get them in the air, water, medicines, dental fillings, home products, and foods sprayed with pesticides and chemical fertilizers. Do you have high levels of these toxic metals in your body, suppressing your immune system, and putting you at a risk for cancer? You better find out before you hear the words, "You have cancer." Mercury, the worst of all, is prevalent in albacore tuna, swordfish, shark, mackerel, and shellfish. It's also used in vaccinations, as well as in silver amalgam dental fillings. If you eat these types of fish, get annual vaccinations, or have had silver amalgam dental fillings at any time during your life, you may have high levels of mercury. When you take advantage of this special offer today, you'll receive a free copy of Hot Metals Suppressing Your Immune System. You feel fatigued. You get frequent colds and flus. You have allergies, rashes, and or infections. Maybe you just don't feel right or take longer to recover from minor illnesses. In the worst cases, toxic metals can cause autoimmune disorders and liver damage, contribute to heart disease, Parkinson's, and Alzheimer's, and of course, they can create conditions that lead to cancer. Unfortunately, conventional doctors will not test you for heavy metals, and once these metals are in your body, they can only be removed by IV chelation therapy or chelating nutrients. I've seen dramatic health improvements in my patients who have had these heavy metals removed. It turns out there's truth to the old saying, get the lead out. To receive my special reports, How to Prevent Cancer and How to Stop over 70 total in the archives. Stop heart disease in its tracks naturally. Radiation exposure. All medical radiologic tests use ionizing radiation, and ionizing radiation is a known carcinogen that can damage cell DNA. Remember that cells with damaged DNA are precancerous cells, and if they don't die or are not killed by your immune system, they can turn into cancer. You get radiation exposure from traditional X-rays, dental X-rays, and mammograms, but the worst of the bunch are from positron emission technology, called a PET scan, and computerized tomography, called a CAT scan. PET and CAT scans expose the body to much larger amounts of radiation than other tests. CAT scans in particular produce 50 to 100 times the radiation of a traditional chest X-ray. There has been a dramatic increase in the number of CAT scans ordered in the last decade, over 60 million of them, and the New England Journal of Medicine says that at least 1/3 are unnecessary. I suspect at least 2/3 are unnecessary. Remember, the radiation from these tests is cumulative, and damage builds up with each test. And for what good reason? A recent study of mammograms concluded that 3,243 women, ages 40 to 59, would have to be tested annually for 10 years to save just 2 lives. And a massive long-term study of 90,000 women by the University of Toronto School of Public Health found that mammogram testing did not reduce breast cancer deaths. Another interesting finding from this study is that mammogram testing resulted in a much higher incidence of diagnosis, and in many cases unnecessary treatment or overtreatment for breast cancer. This study was published in the British Journal of Medicine in 2014. Finally, you should know that 10 years of annual mammogram tests produce a cumulative effect of 10 rads of absorbed radiation, or about the same amount Japanese women receive just 1 mile from the atomic bomb site during World War II. The facts are clear. Mammograms aren't saving lives, but they are increasing women's risk for breast cancer. When you try a no-risk subscription to Natural Way to Health, you can access 2 very important issues in my archives, the vitamin and mineral deficiencies. Our medical schools have long been controlled by the pharmaceutical industry, and in these schools, conventionally trained doctors are taught to diagnose illnesses and diseases and then prescribe specific drugs to treat them. All the emphasis is on treatment with drugs, whether they work or not. There is no emphasis on prevention or wellness, and very little attempt at cures. What's more, nutrition is an afterthought. It's just common sense to avoid things that are known to cause harm and to give your body what it needs for good health, especially when it comes to strengthening your immune system. I can tell you that after testing thousands of patients over the years, I have found severe nutrient deficiencies in the vast majority of them. Some of the most common are iodine, vitamin B12, magnesium, vitamin C, vitamin B1, which is also known as thiamine, and also vitamin D3, selenium, zinc, chromium, and potassium. You simply can't achieve good health, stay healthy, and avoid disease if you have nutrient deficiencies. And the government's recommended daily allowance for some of the most important nutrients are set 5, 10, 20, and in the case of iodine, 100 times too low. For these reasons, you'll need to find a holistic doctor to run the tests we've been discussing today. In my cancer prevention kit, I will tell you how to find one in your area. And if you don't have a holistic doctor nearby, you can discuss with your doctor what you learn in my kit, as well as in Natural Way to Health each month. Then ask him or her to work with you on natural therapies and bioidentical hormone replacement. And that's why you may be surprised to learn that your doctor is open to natural therapies, especially if you prefer them to drugs that may have harmful side effects. Remember, in addition to receiving Natural Way to Health each month, you'll get my Cancer Prevention Kit,